Hi, this is Madison Suffredini, and this is my final research project on yoga movement therapy and other mindfulness techniques for adult clients with dual diagnosis. So, the purpose of my study was to incorporate yoga therapy and mindfulness techniques into patients' treatment at River Edge Hospital. And when I say yoga therapy, I don't mean I made the patients do crazy headstands or like a 50-minute hot yoga session. Rather, the idea was to utilize simple movements and stretches combined with breath work to help the patients to find a connection back into their body. With the research that I found, it suggested that patients, and especially those who struggle with substance abuse or who have been through trauma, are very disconnected from their body and emotions. And instead of finding ways to handle those emotions or pain properly, people who are struggling tend to use substances, abuse substances, self-harm, anger, impulsivity, and other ways to cope with the pain that they are feeling. So, with this project, my hope was that by incorporating yoga and mindfulness into the patient's everyday treatment, was that the patients would be able to discover new coping strategies to utilize when experiencing these overwhelming emotions and distress. Um, and in this case, I focused on anxiety, feelings of anxiety and depression, in hopes to use these as coping skills instead of substance abuse, self-harm, etc. All right, so the target population I worked with specifically was the dual diagnosis residential treatment unit at River Edge. So these patients struggle with both a mental disorder and with substance abuse. Over the 2 week span that I conducted this study, I had a total of 13 patients consisting of 3 female and 10 male with ages ranging from 27 to 65, so quite a big range there. These patients, their diagnoses ranged from multiple different disorders, but what they all did have in common was the substance abuse. And the patients also consisted of multiple different races, ethnicities, socioeconomic background, so kind of a big mixture of people. So as for the intervention, I was able to conduct these interventions into the patient's process group. So patients have to attend process group every single day while they are in treatment. I only did this about three days a week with them over a span of 2 weeks. And so how it would start is I would begin with an opening check-in where patients would tell the group how they were feeling physically, how they were feeling emotionally. And then, so over the 2 weeks, the first week I focused primarily on anxiety. So after asking how you're feeling physically, how you're feeling emotionally, then the patients were asked to rate their anxiety level on a scale of 1 to 10. And then for week 2, again, asked the same check-in question and then asked to rate their depression on a scale of 1 to 10. And then after the check-in, I would ask the patients or encourage them to engage in either the Beck's anxiety inventory or the Beck's depression inventory, depending on what the focus was for the week. And then after that, now I'll go into how the intervention looked in the next slide. But after they took the inventories, I led them through a 25-minute intervention that I had planned for the day. So going to the next one. So for the intervention, I decided to try something different each week to give the patients a variety of mindfulness and yoga techniques that they could utilize. I didn't want them to get bored or just do the same thing over and over, and different things work better or worse for other people. So as for the yoga part, I would incorporate things like simple stretches, or kind of talking in a meditative state, incorporating music, encouraging patients to breathe as they were moving, and statements kind of like, imagine your breath stretching from your fingertips all the way down to your rib cage and expanding from there. Just kind of helping them to be more present in their body and in the moment. And other techniques that I used were like Foursquare breathing, paired muscle relaxation, kind of where you kind of tense up certain parts of your body and then relax it to kind of help relieve the anxiety. And depending on the week, whether it was depression or anxiety, I kind of targeted the movement that I incorporated into the group for ways to help cope with those things. So, for example, with anxiety, I would incorporate yoga postures that worked specifically for that. So, kind of forward folds, where you're kind of compressing the heart to your thighs, ways to slow down the heart rate. And then for depression, things that would kind of open up the heart and get some movement in the body and kind of a reawakening of that energy. So then after the yoga intervention, I encourage the patients to engage in a group discussion of their thoughts about the intervention and just how doing the intervention felt, how it felt in their body, any thoughts or sensations that came up, and then ways or situations they could see themselves utilizing the technique for the future. And then after that, ask them again to complete either the BAI or the BDI in response to how they felt now, so their anxiety levels, where they were after completing the intervention. And so with the results, I calculated each patient's individual score for the before and after the intervention with either the BAI or the BDI. And then after the completion of week 1 and 2, I took the average anxiety level score and put that together in a chart, and then took the average depression level score and put that in a chart and compared it. I did the before and the after, and then took the average before for week 1 and anxiety, compared those, and then the before and after. So the results, what they show, which I'll show you in a second, patients had a higher anxiety level at the beginning of group and a lower anxiety level after group. And similarly, patients had a higher depression level at the beginning of group and a lower depression level after group. And overall, patient anxiety levels seem to be higher compared to depression. And yeah, so I'll show you the results. So here, the before is in the blue, so pretty high. Average was a 4.85. And then after the intervention, goes down to a 1.88. So that was for the anxiety. And then for depression, before 2.85, and then lower 1.19 after the intervention. So you can see the distinction there, the before and after, and the rates, the levels, how they decreased after the interventions. So patients verbally, so besides looking at the results in the charts and what I previously explained, in the discussions that I had with the patients, verbally they reported feeling more relaxed, a release of tension in their body, an ability to focus more efficiently, and they also mentioned that they could see themselves utilizing these skills once they were discharged. And like I said, that was all incorporated in our discussions of where they would see themselves using it, what they found helpful, what they didn't find helpful. And overall, the patients reported that they felt that it was a good change of pace instead of just sitting in groups all day and kind of just talking and talking. So I think that they really enjoyed being able to move a little bit and just incorporate a new type of process group as opposed to a traditional one that they're used to doing every single day. All right, and then these are my references, and that's it.